Hello, good people. My name is Theophilus Nkosipile Theonkosi. I'm the Greenwald Health Consultant. I hope you can see my name here. Today, I'll be addressing a serious disorder, serious diseases, cardiovascular diseases, good people. Cardiovascular diseases, which are really, really concerning me, good people. They are a global problem. They are really, really that bad. As we speak, good people, over 19 million people, good people, over 19 million people have succumbed to cardiovascular diseases worldwide, good people. So this means that we are in a crisis, really. We are in a crisis as the whole world, really. And it is very, very unfortunate because um, millions of innocent lives are being taken away, right? So, and nothing so far is being done really to try and reduce this number. Yes, I think I can't say nothing is being done. Things are being done. Doctors are trying their best. Hospitals are trying their best to try and find a solution to cardiovascular diseases, good people. So today I'll be taking you through cardiovascular diseases, right? So, what are cardiovascular diseases, good people? These are the conditions that are associated with the build up of cholesterol plaque in the artery walls, as well as the build up of fats in the blood. So, these conditions are actually associated, good people, with the problems of the blood and oxygen circulation to the heart as well as to the rest of the body, right? So what are these conditions, good people? We have your atherosclerosis. What is atherosclerosis, good people? Atherosclerosis, I'm not sure if you've heard of that term. Atherosclerosis is the hardening of the arteries caused by the cholesterol plaque buildup in the artery walls, good people. The cholesterol plaque in the artery walls. So what this does is that it reduces the blood that circulates to the heart. It puts pressure on the heart, right? Since there's less pathway for the blood and the oxygen to flow, right? And then we have high blood pressure. High blood pressure, good people, is triggered by the accumulation of the blood fats which we get from the foods that you eat, the fast foods that you eat, from your burgers to your French fries, to your pizzas and so on. All those kinds of fast foods, good people, they all contain the bad fat. They also contain the bad cholesterol. Yes, I did not mention that earlier. They contain the bad cholesterol, what you call the LDL cholesterol. The LDL cholesterol, which is the low density lipoprotein, which is the bad cholesterol, right? So that is unneeded by your heart. That is actually harmful to your heart, good people, right? And then we have what you call myocardial ischemia, which is the damage to the heart that is triggered by the lack of blood and oxygen flow to the heart in time, good people. So your heart ends up becoming damaged, right, in the long term from the atherosclerosis, right? So that is the term given to that is the myocardial ischemia, right? And then we have what you call the myocardial infarction, which is the latest stage of the cardiovascular disease in the heart, right? So myocardial infarction is actually the heart attack. So what happens that the arteries are now completely blocked. So blood and oxygen can no longer flow to the heart. So if that happens for 20 to 40 minutes, good people, if the arteries are completely blocked for 20 to 40 minutes, good people, your heart will die. That is the heart attack, good people. So obviously, yes, that is irreversible. It is irreversible, good people. So that is how serious those conditions are. Symptoms include your angina pectoris, which are the what chest pains, which are the chest pains that result from the limited blood flow to the heart, right? So you should take note of that, good people. So we have that. So also we also have what you call chronic fatigue. Chronic fatigue is the constant tiredness, tiredness, even without working, you just feel tired. Let's say you are on an off day, you're not working today, you're just seated at home, and then you just feel like you are not resting enough, you feel like you're just tired, that is chronic fatigue. That is one of the symptoms that you may be having cardiovascular disease. Some of the symptoms that are associated with cardiovascular diseases and cerebrovascular, that now I'll go to the brain partly, right? So on the brain side, we have what you call chronic headaches, right? That headache that is actually that is actually long term. That headache it's actually that is constant, it is always there. That headache results from what you call the accumulation of lipid in the blood, the accumulation of blood fat, right? So that lipid accumulates in the blood, right? So the blood, what it does is it becomes thicker, good people. It becomes thicker. So when it becomes thicker, the blood what takes tends to take more time to reach the brain. So it's due to the force of gravity, right? So the blood fat, that blood becomes thicker. When it becomes thicker, it becomes heavier, and when it becomes heavier, it puts more stress on the heart. It also takes more time to get to the brain. That is why even when that person stands up quickly, you'll find that they feel that dizziness. So also dizziness is one of the symptoms, good people. Dizziness is one of the symptoms that you may be having cardiovascular disease, cardiovascular or cerebrovascular disease. Remember, those two are intertwined, they are closely connected, the heart and the brain. So if you have a cardiovascular disease, then it is almost certain that you are having the cerebrovascular disease too, which are the diseases that are associated with the brain, right? So these cardiovascular diseases, good people, they are not something that we can play with. They are not something that we can play with. That's why you are seeing me right now. I'm not really laughing. Because these cardiovascular diseases and cerebrovascular diseases are really, 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 really serious, good people. Millions of lives are being taken away, good people. Millions of innocent lives are being taken away. And it is very, very unfortunate, because if we do not take precautionary measures, if we do not prevent these cardiovascular diseases, good people, we are going to get to a stage where the number, it escalates further. We are going to be seeing over 30 million people succumbing to cardiovascular diseases yearly in the next probably 10 years, right? So it is important that we take action. Let us do something, right? So on my next video, I'll be taking you through the solution to cardiovascular diseases. I'll be taking you through the ultimate long-term proven solution to cardiovascular diseases, good people, in the form of green world herbal food supplements, good people, that are actually accredited by the FDA, the Food and Drug Administration of the USA. So I'll be taking you through that solution to cardiovascular diseases. So good people, I believe that it is not the end of the world. It is not the end of the world. We can still stop cardiovascular diseases. We can save the world. We can live a healthy life, good people. We can try and avoid cardiovascular diseases. So what are some of the preventative measures that we can use outside of Greenwald? Since I will mention Greenwald, I will talk about Greenwald in my next video. A few of them are, good people, exercising. Try to regularly exercise your body. It doesn't have to take a long time. You can exercise for what? For 30 minutes. 30 minutes is enough for you to get a good exercise, right? That will actually lower your your blood fat, your cholesterol. It will also help your heart, right? You can also try to eat omega-3 rich foods like your seafood, right? Your seafood, your fish and so on, because they contain the HDL cholesterol, which is the high density lipoprotein, that is the good cholesterol for your heart. So join me in my next video as I take you through the green world long-term solution to cardiovascular diseases. Good people, I thank you and I'll see you in my next video.